This is the frontal belly of the occipitofrontalis. It raises eyebrows and wrinkles the forehead. The origin is the epicranial aponeurosis. The insertion is the eyebrow and forehead skin. This is the occipital belly of the occipitofrontalis. It pulls the scalp backwards. The origin is the occipital and temporal bones. The insertion is the epicranial aponeurosis. This is the corrugator supercilii. It wrinkles eyebrows medially and downward. The origin is the frontal bone. The insertion is the skin of medial forehead. This is the procerus. It helps create an expression of anger and pulls eyebrows down. The origin is the fascia of nasal bone. The insertion is skin of the lower part of forehead. This is the orbicularis oculi. It closes the eyelid. The origin is the nasolacrimal, maxillae, and frontal bone. The insertion is the skin encircling the eye. This is the zygomaticus major and minor. It produces a smile and elevates the upper lip. The origin is the zygomatic bone. The insertion is the muscles at lip corners and skin. This is the nasalis. It flares the nostrils. The origin is the maxillae. The insertion is the nasal aponeurosis. This is the levator labii superioris alicae nasi. It elevates upper lip and flares nose and helps create a snarl. The origin is the maxilla by upper nose. The insertion is the skin of nose and upper lip. This is the levator labii superioris. It allows snarling or pulling up the upper lip and flares nostrils. The origin is the superior edge of maxilla. The insertion is the cartilage and skin of the nose and the upper lip. This is the risorius. It contributes to smiling and frowning. The origin is the mouth angle. The insertion is the platysma and masseter muscles. This is the levator anguli oris. It elevates the angle of the mouth medially. The origin is the skin around the mandible. The insertion is the maxilla. This is the depressor anguli oris. It presses down the corners of the mouth to form frowning. The origin is the mandible. The insertion is the mouth angle. This is the depressor labii inferioris. It draws the lower lip down towards the chin. The origin is the mandible. The insertion is the orbicularis oris. This is the orbicularis oris. It protrudes lips and shapes lips for speech. The origin is the maxilla and deep to the surface of skin. The insertion is the skin at the corners of the mouth. This is the mentalis. It elevates and wrinkles the skin of the chin. The origin is the mandible. The insertion is the chin skin. This is the buccinator. It compresses and contracts the cheeks and helps with chewing. The origin is the maxilla and mandible. The insertion is the orbicularis oris. This is the platysma. It depresses the mandible and pulls skin when clenching. The origin is the pectoralis major and deltoid muscles. The insertion is the mandible. This is the temporalis. It elevates jaw and retracts chin. The origin is the temporal bone. The insertion is the mandible. This is the masseter. It functions in chewing and biting. The origin is the zygomatic process. The insertion is the mandible. This is the medial pterygoid and the lateral pterygoid. It elevates the jaw and protrudes chin. The origin is sphenoid bone. The insertion is the mandible. This is the genioglossus. It protrudes the tongue. The origin is the mandible, and the insertion is the hyoid bone. This is the hyoglossus. It retracts the tongue. The origin is the hyoid bone, and the insertion is the side of the tongue. This is the styloglossus. It draws up the sides of the tongue like a trough. The origin is the styloid process. The insertion is the lateral sides of the tongue. This is the digastric. It depresses the mandible and elevates the hyoid. The origin is the posterior mandible and medial mastoid process. The insertion is the tendon connecting to the hyoid bone. This is the stylohyoid. It elevates and retracts the hyoid. The origin is the styloid process. The insertion is the hyoid. This is the mylohyoid. It supports roof of bottom of mouth, elevates hyoid and tongue, and depresses the mandible. The origin is the posterior mandible, and the insertion is the hyoid. This is the geniohyoid. It elevates and protracts the hyoid. The origin is the posterior mandible, and the insertion is the hyoid. This is the sternohyoid. It depresses the hyoid. The origin is the clavicle and manubrium. The insertion is the hyoid bone. This is the omohyoid. It depresses the hyoid. The origin is the superior scapula. The insertion is the hyoid. This is the sternothyroid. It depresses the larynx. The origin is the manubrium, and the insertion is the larynx. This is the thyrohyoid. It depresses hyoid and elevates the larynx. The origin is the larynx. The insertion is the hyoid. This is the sternocleidomastoid. Its function is head flexion and lateral rotation. The origin is the manubrium and medial clavicle. The insertion is the mastoid process to superior nuchal line. This is the anterior, the middle, and the posterior scalenes. Their function is lateral flexion of the head, elevating first anterior, middle, and second posterior ribs for respiration. The origin is the transverse processes of C2 to C7, and the insertion is the first anterior, middle, and second posterior ribs. This is the splenius capitis. It extends, rotates, and laterally flexes the head. The origin is the spinous processes of C7 to T3. The insertion is the mastoid process and occipital bone. This is the splenius cervicis. It extends head and neck. It is involved in lateral flexion and rotation of the head. The origin is the spinous processes of T3 to T6, and the insertion is the transverse process of C1 to C3. This is the semispinalis capitis. It extends head and neck and rotates the head. The origin is the articular processes of C5 to C7 and transverse processes of T1 to T6. The insertion is the superior and inferior nuchal lines. This is the semispinalis cervicis. Its function is lateral flexion and rotation of the head and extension of cervical spine. The origin is the T1 to T6 transverse processes, and the insertion is the C2 to C5 spinous processes. This is the semispinalis thoracis. Its function is lateral flexion and rotation of the head and extension of cervical and thoracic spine. The origin is T6 to T10 transverse processes, and the insertion is C6 to C7, T1 to T4 spinous processes.